I'm giving you an overview about the case note and how to write a good letter. That will definitely helpful for your exam. Okay. Okay, so this is the case note provided to you. So what's the thing you are going to do first? So you will know that your letter is going to be evaluated by two assessors, like from two different places all over the world. We can't say is it from Australia, is it from England or wherever. But the thing is that it goes to two different assessors. And another important thing is that both of them are assessing your letter with same assessment criteria, so that you can readily available in the OET official OET website. So you can see that there are some criterias for your writing. So this is your baseline criteria, and all your marks is depending on how you're performing in this um, structure, these segments. Okay, so that you can see that purpose, content, conciseness, and clarity, general and style, organizational layout, and language. So all this is you can use while you are writing your letter. So if somebody is very new to OET, so I have to tell you that you will get a case note like this for your exam. Like for that, the exam is 45 minutes time, and the first 5 minutes time is only for the reading time. That means you can read your case note, but you can't even touch your pencil. Your pencil should be on your table. You can't touch your pencil for the first 5 minutes. So that time you can read your case note and understand what's in the case note. Okay. So here we are going to discuss around the same time, 40 to 45 minutes time, like an exam, what you're going to do. So the main thing we are going to do, we are not going to write a letter, but we got some letters already in the group, so that we will discuss along with while we are discussing the case note. Okay. So, and you have to be answer my questions. Some if I'm asking some of the questions to you, like uh, then only it should be a discussion forum for us. Okay. So let's start with what we are going to read as soon as you got this case note to you when you if you are in an examination hall, what you're going to do. Anybody can answer me. Just unmute your mic and speak. That's it. Okay, so what you're going to read. So, okay, we are going to read the first line. That is very important. Okay, so in actual occupational English test case notes, even if it is medicine, even if it is nursing or any other profession, there should be a note and a single line like this that will saying that to who you are and just introducing to who you are and who is your patient. That is the first line. Usually it will be there. So you can read that like, do you want it be zoom a little bit? Is that okay? All right. So your patient 81-year-old woman recently had a right total knee replacement on 25 February 2015. She is being discharged today. Okay. All right. Okay, that's fine. So after that, you're going to read what is the task assigned to you. Okay. So writing task, it you always in the end of the letter, you can read that writing task is given at the end of the letter. So using the information given in the case notes, write a letter of referral to Miss Johnson's local doctor, Dr. Tony Jones, to update him on her condition following her recent surgery and discharge from rehab. Address the letter to Dr. Tony Jones, private practice, 12 New Street, Stillwater. And in your answer, expand the relevant notes into complete sentences. Do not use note form, use letter format. So this is just for the beginners to whom the candidates who are going to just introduce into the OET writing. So this is your writing task. So from this writing task, what you can understand. So please tell me what are the informations you got to write a letter. Okay, so here in this case, what is that purpose? That's why yesterday we discussed the same thing. So, okay, so sorry for that. So you don't know anything about the top part of the case note until now. You are in the examination hall. I know you had done previously read this case note, but this time this point of time, you are in the examination hall and you are going to read only the writing task. From the writing task, what are the information you got? I know there is warfarin and there are some other informations are there, but from the writing task, what you got? That's the point. Okay, so patient had a surgery, okay, want to update him to actually Dr. Tony Jones regarding patient's condition following her discharge from rehabilitation. Okay, so that means this is Miss Johnson's local doctor. That means local GP, general practitioner. So even for nursing, if only the thing you're going to consider you are the nurse, then you can write to the patient's own GP. So consider it as like that. So there is no difference between, too much difference between a medicine one and a nursing one in case note wise. Okay. So only some of the informations you are selecting will be different while you are writing to a doctor. That's the only point. Okay. So, and you are saying that want to update patient's condition because the patient had a recent surgery and the patient had rehabilitation as well. So then you're going to read your case note and understand what surgery the patient had, okay, and what kind of rehabilitation is done, and why the doctors, the patient's own GP need an update regarding Miss Johnson. Okay, that is the question you have to answer in your letter. So that's why you're going to write a letter. Okay, so what you're going to do is you're going to read your case note. So from beginning, and many of us has joined in previous class as well. So what we are going to do is, so this is the first 5 minutes time discussion. So you read the first line, then you're going to read the writing task and understand what you're going to do, what is the purpose of this letter. So give me a moment. Okay, so somebody's mic is on. Please unmute that one so then only the others can listen. Okay, fine. So this is just what we are going to discuss. So it's all about introduction. So in that 5 minutes time, you're going to think about your introduction and you're going to read your case note and all you can read it once or twice, this full case note, and categorize your information into, you can content selection, you can do content selection for the next 5 minutes. I will come to that in a minute. Okay, so we are starting reading from this. So, patient name is Miss Betty Johnson's address is Tolmary Street, Stillwater, marital status without past medical history, aortic valve replacement and pacemaker 2010, osteoarthritis since 2011, pain and mobility increased past 3 years, immobility increased past 3 years, for right, okay, total knee replacement, February 2015, full blood work, typing and cross-matching done, X-rays, ECGs, etc. Regular medications from on that particular days, it's you can see that particular date here. So paracetamol, warfarin, and enoxaparin, and social background is given, postoperative details are given. That means the date of surgery and the following postoperative days, and the patient's condition is explained in different dates. What's the condition of the patient is not given as anything like that, medical history or something like that, because this is a medicine case note. It is usually like date of visit or patient's condition is throughout the stage, throughout the hospitalization period. Okay. Okay. So we are coming back to our welcome slide. So what we are going to do is we are writing and thinking about an introduction. A letter need an introduction, and you have to plan your time, then only you can finish your letter within stipulated time, that is 40 minutes the writing time and the 5 minutes reading time. And you have to think about that, and you have to organize your letter by paragraph wise, first body paragraph and second body paragraph, then conclusion and likewise. And you have to look into the all the criterias for the evaluation as well while you are writing your letter. Okay, so here you can see that the purpose of the letter, that is got a band 3 here, okay, and all other bands is 7 and 6 until from 1, 2, 3, 4, 5, 6, and 7. So the maximum band for all these five criteria is 7, only for the purpose that is 3. So the purpose of the letter we know from the writing task itself. So while creating your introduction, you have to careful about this purpose and this writing criteria. So the purpose of the document is immediately apparent. That means you have to write your purpose of the letter immediately in the introduction. So what you're going to do, what is the purpose of this letter? So do you want to read this entire case note before we are going to discuss the case note or not? So have you had already read this case note, or have you had try to write a letter with this case note? Okay, okay, that's fine. Okay, that's why I just want to write a letter before attending this session. Okay, so we got a letter, so we are going to discuss the introduction. I don't know who wrote this letter, but we are going to discuss that letter along with this case note. Okay, so all right, that's good. So what's your introduction is here is I'm writing to refer Miss Johnson, who is a widow and lives alone. So I just want to ask, not to you, anybody others who can answer me, is it covers our purpose or this criteria for the purpose itself or not? The purpose is of the document is immediately apparent and sufficiently expanded as required. Okay, okay. So why it is? Okay, Okay, what are the 2 points that we have to write in our introduction? Okay, so the purpose itself, that should isn't it? Purpose and what else? Okay, that means presenting compliant of the patient. Okay, presenting condition of the patient. What's the patient's condition? Then only the GP can understand what is the present condition of the patient, isn't it? So that two important things you have to consider while writing your introduction. Your introduction, you are going to update regarding this patients means you are writing to the patient's own GP. So the patient's own GP know everything about the patient, but only some of the information is unknown. What are that informations? Because the patient comes to you for a surgery. From that moment onwards, what happened for that patient in your hospital is not known to the GP. That's why we are writing this letter. What happened during hospitalization? That's why we are writing this letter. Have you cleared that? Have you got the point now? Okay, so that's why you need to write the introduction should be clearly says that the patient underwent a surgery, okay, and what she requires. She requires follow-up care, whatever, what is exactly the need for the letter that's already we can see from the writing task down here. That means we have to update regarding the condition and follow up her condition and follow up care. That is what we are writing this letter to the patient's own GP. Is that correct or not? Is that clear to all? Is anybody who is just new to OET or not? Oh, that's wonderful. And is anybody else is there? Please, I can see so many people already joined in the session, even 9 people. That's wonderful. But I need to know who need more attention. Like, just want to use it if I want to go deep or not. That's why, because we don't have much time. Okay, okay. So yeah, that's why I just want to. Otherwise, I'm keep going on, and it will not be any useful for you. So just as soon as you got the case note in your exam, what we are going to do, the case note is just representing a patient's condition. So you are going to write a letter, maybe a referral letter, maybe a transfer letter, maybe um, it may be some kind of letter. It should be a semi-formal format as well. So you're going to write a letter from your side to another person, like maybe a doctor, maybe to another social worker, maybe to a layperson, maybe to another community nurse. So it's all depend upon it. It all given in your writing task to whom you are writing. So, and from that point, you should understand they will mention why we are writing this letter also in this writing task. Okay, from this writing task is very very important for you to draft your introduction. Okay, so when we comes to the times management, so we already said that this case note will given to you just before the start of the exam, and you have 5 minutes only reading time. So that time you're going to read only the first line, then immediately after that you're going to read the writing task. Okay, then you're coming back and reading your case note carefully and understand what is in that case note. And while you're reading your writing task itself, you may know that this purpose for this purpose I'm going to write this letter. So then you ask why is that purpose is important. Okay, so if you think like that, you can find the answer in the case note. So that's why it is very, very important. And You just read one time, then if you go time, read another time in that 5 minutes time, then again take your pencil and start doing your next step. So, introduction, you have to draft. Okay, so again, planning, that's what we are going to discuss now. The 5 minutes time is just to read, then take another 5 more minutes to read your case note carefully and do your content selection. That is the part of organization. So you have to select your content carefully and wisely according to whom you are writing the letter. Okay, so key informations needed for the letter you have to include. So you have to uh, take another 5 more minutes to find out which information is important for writing this particular letter. So you have to think like that. This information is relevant, this is semi-relevant, or this information is irrelevant for this letter. So that's what we are going to do next step. Okay. So when we see this case note and while we are reading, so what we had done yesterday as well, the same thing. So we are going to discuss each sentence and please tell me which one is relevant, which one is semi-relevant, which one is irrelevant. So from past medical history, we can talk about. Yes, please start then. So one of you can tell me aortic valve replacement and pacemaker 2010. Is that single line? You can see that that is a case note regarding the patient. Is it important or not? Relevant, semi-relevant, or irrelevant in this case? Okay, so you're saying it is relevant. Okay, next one. Osteoarthritis since 2011. Pain and the mobility increased past 3 years. Okay, relevant. Okay, so you're saying it is relevant as well. Okay, wonderful. So, four, right TKR February 2015, full blood work, typing and cross matching, X rays, ECG, etc. Is it relevant or not relevant? Okay, so, all right. Regular medications, paracetamol 665 milligram, 2 tabs, TDS, warfarin 3 milligram, morning, course ceased 5 days preoperatively, started Clexine, so anticoagulant. So is that all information is relevant or irrelevant? Okay, saying all this information is relevant. Okay, that's fine. Social background. So you're saying it's not relevant as well. Okay, I got two different ideas. Then we will come and discuss when we finish until social background. Okay, so social background. Without 1986, lives alone, 4 children. Is it relevant or irrelevant or semi-relevant? You can say that as well. Hmm. Okay, so coming back, what we discussed according to writing assessment criteria. So you can see that why I put organization is in content selection is content is the first thing after your purpose. So purpose of the document is immediately apparent that you can see here. So the next one is content. So for that band 7 score is the, so content should be appropriate to intended reader. That is they are talking about. So content is key information needs to include no important details missing. Okay. So why it is intended to reader? What it means? That means you should consider the reader. Who is the reader in this case? Whose GP? Patient's own GP. What is important? What is important in this case note? Pink. Yes, that's the only everything. Wonderful. Yeah. Yeah, that's the point I need to tell you from your side. That means aortic valve replacement and pacemaker not relevant because the patient know about this. The patient's GP know about this. Osteoarthritis is not relevant because the patient's or GP know about this. Okay, it is past 3 years case. The patient is came from the GP side to the surgery. Okay, even for right TKR February 2015, full, full blood work typing all disease from the GP side they had done it. Okay, so that's why that's all not at all important. Only important thing is that so this but see the date. Yes, that means here you can see that the date for the surgery is 25/02 to 2015. So that day you should consider always because on that day onwards, you can say the patient, why the patient is on paracetamol. You don't know the patient, that medication is started from the hospital for the pain management. You don't know that. So maybe it is started on that particular date. So consider that medication because that's not said in the past medical history. So from here onwards, it is going to be relevant. Paracetamol started for the management of pain because the patient is going to have a surgery. Is that clear? Okay, so why warfarin? Any of the yes, blood thinner. So warfarin 3 milligram morning. You should expand the abbreviations. Don't write main. You should expand. If it is given main, that is given for a purpose. Okay? Please explain it like it is in the morning. They have to take that warfarin 3 milligram and ceased 5 days preoperatively. This is you all started even before, but you can discuss that. Okay? So again, what happened? Started Clexine on they didn't mention the date now, so maybe when we are going to discuss the later case note, they will say the exact date when Clexine started. Okay, so again, that part is important. You can discuss this thing in your letter. So we didn't say which part we are going to discuss this. We are just discussing this is important while considering this case. Okay, so that's why we need to do important step, that is while doing time management, the next 5 minutes after your reading time, you're going to do content selection. So if you do your content selection clearly, then you will get what is in the next step in the writing assessment criteria is conciseness and clarity. That means you will get a clear picture about the letter. Okay, that means you are not going to include any unwanted informations. All right, is that clear? Okay, fine. Move forward then. We are going to discuss about social background. We already said because patients on GP don't want to write widower 1986 lives alone, 4 children and all. We don't need it. It's unwanted information. So we are not going to write that information. Okay. So after the surgery, it's given post-operatively. Okay. So post-operatively, what happened is given the time based it is given, so you have to take each point carefully and find out which is relevant, semi-relevant and irrelevant. So please continue with sorry continue with post-operative until the end of 26 February 2015. Okay. Vital sign stable. Sorry. Vital sign stable. So semi-relevant. Not yeah. We'll consider something like this. Okay. So circulation observed good. Knee increased on, yeah, elevated on pillow, yeah, relevant. So hemoglobin, okay, IV, okay. So is anybody other can tell me what is increased regular oral paracetamol? 1 gram is important or not? Okay, so that means it's also important. So coming to next point. Okay, okay, okay. Next one. Wound nil ooze. Okay, you're saying it's semi-relevant or irrelevant. So one consider it as a semi-relevant. Okay, fine. All right. If somebody else can tell me 26 February 2015 information is relevant, semi-relevant, or irrelevant, because it's a big case note. I need to do it quickly, then only we can finish the discussion on time. Please. Okay. Mm-hmm. Okay. 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 So come back to that in a minute. So, okay, what we discussed until now is just we are going to draft an introduction. What we said that introduction should contain 2 points. That is, one is you need to tell what is the present condition of the patient that you have to mention in the first line itself, because this is patients on GP. Then you can write, I'm writing to update regarding Mrs. X, okay, who underwent a surgery. Okay, so which surgery you can mention? Then you can mention that he requires follow-up care and management, and she is being discharged today, or whatever you want to write. So that's your introduction is clear. Okay, I'm writing to update Mrs. X. Okay, sorry, somebody is calling. Right. Okay, so that's fine. So introduction is I'm writing to update because you're going to write the patient's on GB, isn't it? So you can write that because it's already mentioned that. Okay. So regarding Miss X, whatever the name will change in case note, but the thing is that it stands still. So then again, you can write that the patient's condition who underwent a surgery. Okay, you can full stop that sentence there. Then you can write he requires follow up. What is the purpose from the receiver's end we need for this patient? Okay, so after that what we are going to do is you can just mention one more thing, that the patient is going to be discharged today, so it's finished with the introduction. Then we are going to select the content, all each and every information in the case note, think in and think like this, whether it is relevant, semi-relevant, or irrelevant. Okay, so what we discussed here into the in the post-operative 11:30 a.m. Patient is returned to ward following right TKR, and when it considered as a medicine case note, you should consider it as a whole thing because you can see that case note have so many dates. You will be very confusing while you are seeing all these informations. All of the informations looks like very relevant to you. Okay, why it is that? See, return to ward following right after right TKR, vital signs, because it's not semi-relevant because all is in the normal range. When it is considered in the normal range, don't write it because you got a lot of informations to write and look behind. You can see that lot of informations down after that. So circulation observed good and knee elevated on pillow. Knee elevated on pillow. Circulation observation good. Two points are the circulation is good. Don't want to write. Why? Because that's a normal thing. If you find any abnormal thing that needed to tell to the patient's GP, that need to be tell. And another important information is that as soon as the surgery, what you had provided to the patient. So here you had informed the patient to elevate knee on pillow. So that's one point you can write. Okay. So this is important. And hemoglobin, is it important or not? It definitely important because a transfusion is done. So you have to mention that because the HB is low, so you had done a transfusion. Then again, antibiotic is important, definitely important because that you had provided that and the antibiotic therapy while the patient in the hospital. Okay, then increase regular oral paracetamol to 1 gram QDS or not. From this point onwards, you should think what is past medical history. Why be written even if it is the patient's own GP know about the paracetamol 625, so 665 that is increased to 1 gram to manage the pain. Okay, so that means the patient was on 665 milligram 2 tablets TGS paracetamol and the dosage is increased to 1 gram to manage the pain. So that is still QDS. That means 3 times a day. So you have to mention that 3 times a day while you're writing the exam. Even if you're writing to a medical professional, the letter needs to be, the abbreviation needs to be explained. That is better for getting a more, because that's given for a purpose to check whether you know that or not. Okay. So again, next point, we are coming to the next point, that is patient controlled analgesia PCA morphine effective. So patient is on patient controlled analgesia morphine. That is also an important information. That is a CD drug that you had administered while the patient in the hospital that needs to know the patients on GP. You can mention that wound is normal at present. Don't, it's not a semi-relevant. You don't want to write it because you got a lot of information you can include later in the letter. Okay, so coming to 2602 and 2015, that means wound good and sponged don't need because that is a normal thing. It's nothing special with that. If you find any abnormal thing, you have to spot it. Okay, restart warfarin 5 mg today. Again, changes in the medication is a need to know thing. So you need to mention that again. Yeah. So restart warfarin was restarted on that particular day. You can mention that. And again, Clexane 80 mg given for anticoagulation. That's also still the Clexane is also on that particular day is there. And PCA is stopped and started oxycodone tablet 5 to 10 milligram PRN. Needs to know, it's not a irrelevant information. It is a very important information. Even after the surgery, the patient is going with the wound and things. So there should be pain. So need to be manage the pain. So the PRN oxycodone 5 to 10 milligram is a very important information that the patients on GP need to know. Think like this and clearly understand what is relevant, what is irrelevant, what is semi-relevant. Okay, according to whom you are writing, Think you are the GP, you are the patient's GP. What are the informations you want to know? So that you think like that, then only you can understand what are the informations you need for this letter. Again, pathology. So you don't want to write it because nothing with that. The test is a routine one, maybe after the surgery. And here you can mention HB is 100 gram per liter and commence ferritab. We said something about IVD transfusion when the patient's HB was low, around 80 gram per liter after the surgery on a day before. So today we increased the HB is increased to 100 gram per liter. So we started commence ferritab iron sulfate tablet 300 milligram in the morning. Is also an important information. Have you got it or not now? Is it clear? Okay, so is anybody have any doubts until now? Yes, that's why. But what we are just in the first 10 minutes time, dear. We are not going to finish the letter. We didn't started writing the letter. We are just selecting the case note. So that's why it's a big case note for medicines usually like this, and for sometimes for the nursing as well. Lots of informations are there, so it will get you confused a lot. That is the purpose of the real case note like that. So that's why you have to be very careful while writing the letter. Okay, so we will move on with this informations and we will come back to the next step. Okay, so again, 2702 2015, Fluxin again 80 mg, start warfarin 5 mg nocte, removal of dressing, wound, good, routine, all that clips is removed on 3 2015. Is that all info? Is there any important information? Is there or not? Just quickly said me. Again, Daniel Farouk. So many times. Yes, on that particular date, that is important, need to know to the patient's GP. So think like that. So, so you should underline this. Okay. So what I'm going to do at the end of the letter means again you will be get confused. Coming to the next point, 2802. You should tell me quickly, then only we can finish this on time. Crutches, short walks, wound good, febrile, Claxine 80 milligram given. Okay. Hmm. Do you think wound good and febrile is important? And short walks, yes. Again, on 3, Claxine, no. 2 3, X-rays, blood, INR 3, HP, ECG, managing for foreign minimum assistance. No, the walking minimum assistance. Yeah. Cis Claxine. So some of the information is important here. That is this one, and Claxine is stopped on that particular date. Okay. So now it is from 3 to 5. Okay. Wound clean, routine, all clips tomorrow, like it's already mentioned. Yes, please. Okay. Mobility goods observations is done. So no need. Okay. 6 3. Again, remaining clips needs to be removed. Okay. Pathology transfer to rehabilitation. Okay. Rehabilitation. Okay. So why the patient is transferring to rehab? That's the question again. Admission. Okay, patient is stable. The patient is going to rehabilitation on 7/3/2015. Admission complete, stable. Okay, circulation, mobility, crutches good. Again, 8 to 13, mobility, frame use, trial, stick, pool, gentle exercises, good, showering. minimum assistant with minimum assistance, and pathology and X-rays is done on 14/03/2015 again. Frame use means to walk. The patient is walking with the frame, just to walk with the crutches like a frame. Okay, the assistance for the walking. That's so the patient had a surgery. Think the patient needed mobility assistance. Okay, using frame. That's it. All right. So again, pathology INR on 14.3. INR is 3.8. Warfarin is decreased 4 milligram on Noctave. What it means? SP. Yes. Again, Ferritab is 150 milligram again in the morning. Yes. Again, 15 to 19. What happened? Uneventful, gradually increased independence. Wound good. Observations done. Physio exercises good. Home list provided. On 25/03, what is going to happen and what is your task? When is the patient is going to discharge or not? So please tell me what's important in 21st March 2015. Okay, so okay, home. Okay, that's fine. It's important. Okay. Yes. Mm-hmm. Okay, coming. Yeah, what we need to know, just select each point. Discharge with home nursing assistance, personal hygiene, home care. Take that sentence. Tell me whether it is relevant, semi-relevant, or irrelevant. That's what we are going to do. That is the content selection. Okay. So we can think that is important. Okay. 1. Wound exposed. Shower with minimum assistance. Stick or frame PRN. Okay. So that's two things. One is that one, and stick and frame is also important. Discharge medication. Warfarin 4 milligram. Ferritab 150 milligram. Paracetamol 1 gram QDS. Oxycodone 5 to 10 milligram PRN. Okay. Rehab appointment in 2 weeks time. So somebody's mic is, if you can mute that one, that would be highly appreciated. All right. So is that able to, could you please mute that one? So otherwise I have to mute you. All right, that's fine. So rehabilitation appointment in 2 weeks. Okay. Advised to see local doctor in 1 week time. And referral for local doctor suggests repeat FBE and INR. Okay. So what we are writing this letter, because that's already mentioned. That's why we are writing this letter. Okay. So all other informations you can see that tick, 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 and tick. So that needs to be said to the patients on GB. This is all about the story. So this is all only the content selection. Sorry. Okay, so content selection, key informations. We got key informations that is needed for this letter. So if we got key information only, so there is no irrelevant information included. That means there should be a conciseness and clarity of the information we are going to provide in the letter. Okay, so what is next step? Next step is implementation. That means writing the actual letter. So what you had done means you just done the first 5 minutes you read your letter, means the case note, like writing task first, then you started reading from the top to bottom for a couple of times. Then you use your pencils to find out which is actually the needed informations for your letter. Because when you understand the purpose of the letter, then you can find out which relevant information or semi-relevant information which is needed for this letter to write. Okay, and if you read the writing task carefully, then you can find that to whom you are writing the letter and the patient's condition as well from that 2 point and the purpose as well. So that's 2 points, like the present condition of the patient along with the purpose of the letter. You can draft your introduction. So your introduction is done and you had selected all the important information to explain what happened to that patient while the patient in your care. Okay, so that means we are going back to the introduction itself. That means introduction should be immediately apparent. That means the purpose of the letter should clear from the introduction itself. So, and there is another important thing that you can see, that is the introduction should be sufficiently expanded. That means in the later in the paragraph, you should express why this patient requires follow-up care and management. Okay, so that's why you have to explain and you have to ask that question and explain in the following paragraphs in a continuous manner, in a related manner. It should be, there should be a connection between the paragraph. Have you got it or not? Okay, so coming to implementation. So when you're going to write your letter, again, you got only, now your time is 10 minutes from the examination time. So that means that time onwards, you're going to write the letter. Before that, you are going to organize your main paragraphs and you are going to clearly laying out your letter. So organization and layout is important for that. So you're going to plan it again before writing your letter. So you should think that, so the patient admitted on this particular date and patient had a surgery, and immediately after the surgery, what happened to that patient and what care you had provided to the patient. And you can consider in this case, after one is in the hospital, as soon as the, or you can say the as soon as the surgery, or the, you can see that you can mention it as a post-operative period. Then again, you can say that there is another phrase that is a rehabilitation phase. Okay, so these two things you can consider two ideas. So you can mention that two ideas in two different paragraphs. Okay, so then you can mention, that means you are going to write again, you are going to consider which one is, which important information got priority. Okay, like you got all the relevant informations for the letter, even you're going to think which one is priority. So you're going to categorize your information, which one is prior important, which one is less important. So you're going to write according to that. So you're going to paragraphing your letter. The first paragraph, you're going to write that the patient was admitted to hospital and done a surgery, and immediately what are the things we had done, we had provided during the hospitalization, what are the changes done in the medications, and what about the wound dressing and all that things. Okay, the patient, when the patient is get improved on this particular date and patient move to rehabilitations. Okay, that is a different center, so the admission is made on that particular date. So from that onwards, you can write a separate paragraph what had done on that rehabilitation stage as well, like regarding mobility issues. You can say the warfare in the medication changes as well in that as well. Okay, then you can conclude with what are the information you need to give to the GP about this patient's condition. So that means then you will get a actual style and general for this particular letter, and you are, then you're going to, this is all you're doing before writing the exam. Just you are drafting your first paragraph. You are thinking that you're going to write this one in your first paragraph and this information in the second paragraph, and my third paragraph include these all the information I'm going to write in my third paragraph. So then you are going to write the conclusion. That's it. Okay, so when you done this, If you draft your letter like that, if you write your letter, it will take less than 15 to 20 minutes. Just you are writing from your own mind. So you had already had all that points. You are making a sentence from that case notes and connecting it. That means the sentence structure and grammatically good vocabulary with all that things. The language needs to be very clear. So that's the thing. You need assistance from an expert, like you have to write a good sentence structure and all. So that's why we need to help you with that things. And you have to write a good letter with all that things. Okay, you got the point, isn't it? So the organization is important. Okay, the general and style is important, and layout is important, and language is also important. So when it comes to like that, so what we are going to write in this case, we can see some of the letter is already here. So I don't know. It's somebody told this is okay. Where's that? Okay, fine. So after that, first paragraph is about so, had a history of aortic valve replacement. What we got? We didn't know. We don't want this information, okay? Because according to our own criteria selection means our own, the information selection. We didn't got this information. Pacemaker things, 2010. All these are histories. So we don't need these histories because we didn't got these informations in this case note as relevant for particularly for this case note. Okay, so what is relevant is that the patient admitted on 25th February 2015 for a surgery, and after post-operative surgery, what are the things you had done? So patient's knee was elevated with a pillow. Okay, HB was low, IVD transfusion done. So while you are writing, the paragraph, what you need to do is look for the connection between all the case note that is relevant. You already selected in the case note, like HP is lower and which is improved to 100 gram per liter and Ferritab, and it's not done there. So the Ferritab is reduced, reduced to 150 milligram and needs to be continued. Have you got it? That's what the sentence structure like. You can write, so you can start in the patient was admitted for this surgery and surgery was done. The patient condition was like this, and patient's HB was initially it was 80 gram per liter, and transfusion was done. But later it was the transfusion was stopped, and HB was improved to 100 gram per liter and commenced Ferritab 300 milligram main in the morning, and later on this particular date, on this date, it is decreased to 150 milligram, and which is needs to be continued after the discharge. So it needs to be continued. So okay, let's see what you had written. Okay, so that's why even if I'm going to discuss all that, like, the word by word, the sentence construction and structure, it will take another 1 or 2 hours. And that's why I'm here. Like, the purpose of my class is to direct you to that particular session. Okay? Have you got it? All right. So that means you need more, the practice regarding that. While you are writing the letter, you will get that point how to write that kind of sentence, and it needs to be connected. So what my point is, you should understand what is the connection, what is the cohesion and coherence in this letter. So that's why this information is scattered here and there, but needs to be connected well. And again, so patient-controlled analgesia, that PCA was morphine was started, stopped on, and again started with oxycodone, and needs to be same thing again, Clexine warfarin combination. So the Clexine and warfarin is there for a purpose, that is also controlled and needs to be continued like this. So you are going to discuss that all in a packet thing. So then you will get only few things in your conclusion to write like this. Only we got so many things to tell in the conclusion, like patient is discharged with home nursing assistance, that you can tell, and patient is with, while rehabilitation again, while we are talking in the second body paragraph in the rehabilitation, so you can see that verse 7th is start of the rehabilitation. So mobility, that is why the rehabilitation started, frame you started. So now the patient is showering with minimum assistance. That means the patient requires minimal assistance even though the patient is going to be discharged. Okay, so from this point onwards, you can club that information with what we need to do with this information. That means discharged with home nursing assistant, personal hygiene, home care needed, and wound care you can mention as well. So that means which one you will give priority, wound or mobility. Patient had got medications, wound, and personal hygiene and mobility issues. These are the four important. Okay. Okay. So in that, you're going to write first the medication, then you're going to write, because the patient is on IV antibiotics and all that, you can mention that the patient was on these all medications while in the hospital. Then again, the patient is, yeah, then the second priority is going to be the what happened to the wound, and what is the present condition of the wound, and what we need to do, that the what the receiver's point of view, what they need to do for this particular wound, and needs to be do the dressing or something like that, wound exposed, so there is no need of wound dressing at all. So that you can say, and shower with minimum assistance, and what regarding mobility comes under next, then about personal hygiene you can mention at last. Okay, so I think we are going to finish our session. Somebody's joined. All right, so Anina, so this is all about the letter that we are going to discuss today. So what you feel about all this? Have you understand it or not? Have you got at least an idea? So what we are going to say to you, that is it how we are going to write a letter? Are you able to write a good letter with all these informations? Yes, of course we can do and post. Yeah, definitely we can do the thing. See, that's what I already told you, that you can go for if you want. Like we are doing personal correction services for every candidate. If you really interested, and it is very minimum price, that is £3 per letter, and the minimum subscription is 10 letter. So you can go for that, and we have reading and listening strategies class, only strategies class. We don't have the perfect, like every day go for a listening test and all. We are not going to do that. We are giving only 4 classes, and part A, part B, and part C in 3 different strategies, and 1 practical examination. So that's all about reading and listening, what we are going to do for that, and speaking individual session as well. So this is all about our class, and if you want, you can go for that. That's a very minimal price as well. So that's why we are conducting this, the basic kind of discussion with our candidates, and I think it will be useful for you. Definitely. when you are going to write your OET examination as a whole. So that's all about our presentation. Okay, so even language and spelling, the last what I'm going to say, we didn't completed our time management yet. Okay, we can continue with that. Like, so you had read your letter in the first 5 minutes, then another 5 minutes you're going to um, again use your pencil and mark and find out what content selection is here, key informations you are going to select, and then you're going to manage your manage your the you're going to implement that case note in a organized manner, and layout will be the and style will be the. So then you can write your letter within 20 minutes, then around 20 to 50, 25 minutes, then you will get, definitely you will get 2 to 3 minutes to look after your letter. So when you are going to read your letter, I can tell you some simple strategies that for checking your language, it is very important. So while you are checking your while you're reading your letter at the end of your letter writing, so you can look that letter as the receiver's point of view. So that means you can be the patient's on GB and think how you got that letter somebody written to you. So when you think like that, then you will know that this information is not needed for me because I already knew this point because I know this patient. Like that, you can understand. Another point is that you can just scan your document like a PT scan. That means I usually use that for and just to tell that the PE stand for punctuation. Just look for any commas or any full stop is missed or something like that. So quickly you can go for tense, maybe is or was or has or had or something were, or it may be changed. So you can definitely look for the simple tense corrections in that few minutes time. And again, subject verb agreement, that is the singular to singular and plural to plural, all that kinds you can think that in particular 2 minutes time. And A is for articles, you can check for whether some important information is needs to, or some the some word need an article or not, if you miss that or not. So again, um, capitals, you can I missed that C part, so it's PT scan that I used to tell. So C is for capitals, you can check whether you started with capitals as soon as the full stop, or you can check for articles, then you can check for numbers, again the plural and all that information. Just to tell you, this is what you can do to write a good letter and get your required score in your OET exam. Okay. It is from the introduction to the conclusion. Introduction to the conclusion. Okay, so that means you can write 180 to 200. So another important thing is that all case notes in the exam is specifically designed to meet that requirements of 180 to 200 words. That means if you are selecting the appropriate informations for that particular letter, that letter will stand between 180 to 200 words. And if you are selecting some information that is unwanted information, then your letter going to be more than 200 words. And again, if you written with some of the letters, you can't say some of the information, you will think that is semi-relevant. If you include that kind of information with your letter, it will be okay that even if it is 200 to 210 words, that's not going to be decrease your marks. Okay, and even if it is, if you written exactly 170 words with all the information that is needed for the reader to understand what the patient, what the receiver needs to do for the patient, is also okay with that point of view. Okay. All right, so we're going to, it's a long session actually. It's going to be more than 1 hour and 15 minutes. Okay, so